Hello and welcome to Understanding Your Fertility. This is a series of podcasts with highly regarded fertility specialist Aykut Bayrak, MD. Dr. Bayrak is the founder and medical director of LA Clinic. I am your host, Elif Sarcel, and I'm happy to participate in these conversations designed to inform listeners preparing for parenthood. Today, we are going to discuss egg freezing and help listeners understand if this is the right choice for them. Hello, Dr. Bayrak.
Hello. It's great to join you. I'm excited to another podcast today with you, Elif. Thank you.
So, egg freezing is a procedure that offers women the ability to delay pregnancy. It was developed in the 1980s and along with IVF has revolutionized childbearing by giving women who have medical and sometimes lifestyle reasons the option of having a family in the future. I know you've done extensive work in this field, and I have a lot of questions for you on this subject. First of all, can you explain for our listeners what egg freezing is and how it is done?
Of course. As you said, Elif, egg freezing has been around since the mid-1980s. I think the first case was done in 1986 or 88. But for many years, it really didn't produce successful outcomes up until the early to mid-2000s. So for almost 10 to 15 years, it really did not improve at all. And that's due to the reason that we really didn't know how to freeze eggs in a sound, healthy way and thaw them with high success rates. So the yield was so low, success rates were so low that it was really not a preferred method to preserve fertility. Up until the 2000s, when more of the physiological aspects of the egg, how to freeze it, how to thaw it, knowing what's inside the egg, about the dynamics were discovered. And from that point on, a lot of research went into egg freezing, and significantly higher success rates were reported in the mid-2000s. 2005 to 2010 were probably majority of the studies that came out that showed successful outcomes. So the success was anywhere between 5 to 10% in probably the 80s, up to about 40-50% in the mid-2000s. So that's a dramatic improvement, which then followed by many additional studies, some of which we have actually contributed. We had a number of studies that looked at egg freezing from egg donors, from non-egg donor patients, and we also genetically tested some of those embryos, which we'll talk about in a little bit. But in the early part of 2010s, the American Society for Reproductive Medicine, based on medical research, removed the experimental label of egg freezing, because prior to that it used to be called experimental or labeled as experimental, because there was really no good sound way or standard way of freezing and thawing the eggs, and the success rates were not as reliable. So that, I think, historic aspect of is important for us to understand that egg freezing is still new. It's not like it's been done for the last 30, 40 years. It's still a new technology. And the way that we do it now is vastly different than 10 and 20 years ago. But the success rates are also very highly improved. So I think that's one important thing that we need to know. The way that it works is, which is, I think, what the question was about, even though I got a little sidetracked there with history. So, but the goal is to really freeze multiple eggs that have been matured and frozen so that those eggs can be thawed and fertilized in the future, and embryos can be created, which then would result in a transfer of an embryo into the uterus, which would then result in a healthy pregnancy. So the whole goal is preserving the eggs while we have the eggs, while they're still healthy, so that when you run out of eggs, or when the egg reserve is low, or the egg quality is low, and when things become a little more difficult to become pregnant, at least we have some backup. So that's the kind of the whole purpose of freezing eggs, for whatever reason it might be. And there are many different reasons to freeze eggs, which I'm pretty sure we're going to talk about in the upcoming minutes. But the whole goal is really to freeze now and save for the rainy day, in a way.
Well, thank you so much for giving us that excellent explanation of its evolution, actually. And so the question is, who typically needs to have this procedure? And is there an ideal time for it?
That's an excellent question. Egg freezing was initially really designed and considered for women or individuals who were at a significant risk of losing their egg reserve. And those are patients who have cancers. So if somebody is going to undergo removal of their ovaries because they have multiple cysts or cancer, or if somebody is going to undergo radiation for a type of pelvic cancer, or if somebody is going to undergo some type of chemotherapeutic regimen for a cancerous growth in their body, whatever that may be, all of these type of treatments, removal of organs, getting exposed to radiation therapy, and chemotherapy, they all affect the egg reserve, and they decrease the egg reserve significantly. And as we know, women are born with a finite number of eggs. So we got all the eggs, somewhere between 1 million to 1.5 million, most people believe. And then when somebody reaches puberty, that number goes down to half to 1/3 approximately. And then from there on, we don't make new eggs, meaning we don't replenish the loss, but rather lose more over time. So because there's that gradual and inevitable loss, chemotherapy or radiation therapy or removal of one of the ovaries or both certainly decrease the egg reserve further. So in those individuals, just prior to starting those treatments, freezing eggs was really proposed and still being done. One of the main reasons nowadays to freeze eggs in that population is really, cancer treatment. That has expanded, certainly. So it's just we're not freezing eggs for cancer patients any longer, obviously. So it's done for a variety of different reasons, and mostly for social reasons these days. Most women are now aware that this technology exists, whereas in maybe just about 10 years ago, a lot of people actually would come in and say, I never knew that you could freeze the eggs. I actually thought that you could freeze embryos, or they didn't even know about embryo freezing. So now that with the social media and people becoming more aware, I think there is more awareness, number one. I think there is certainly easier access to care, at least in certain populations, let's put it that way. And also the success rates are better. So all of that, I think, has fed into the fact that now more and more people are not only asking for it, but also freezing their eggs for elective reasons, which is if somebody's single and they're concerned about their fertility, they would like to freeze their eggs because at one point they know for sure that they're going to run out of eggs. And this is normal, physiologic, as expected, and everybody loses their eggs over time. It's inevitable. That's how we're created. So everybody goes into menopause, right? So that happens. So this is a totally physiological event. So I think in today's world, certainly cancer is one issue. Elective egg freezing for social reasons is another. And sometimes people have other diseases like arthritis or lupus, and they're exposed to certain medications that may or may not be chemotherapeutic agents that can affect their egg reserve. So there can be an impact in a way on their egg quantity and eventually quality. There are also other diseases that can lower the egg reserve, like severe endometriosis. So if somebody has severe endometriosis themselves, or a strong family history of endometriosis, or if they have a strong family of premature menopause, let's say their mom went into menopause at age 38 and they are 32, well, that person should probably freeze their eggs because they're at risk genetically. So there are many other indications, and this goes into individualized medicine and kind of customizing the care for each individual, where there's no really cutoff for egg freezing. So it's not like you're 39, you have to freeze your eggs, or you're 29 and you absolutely don't have to worry about your egg reserve. So we can have a 28-year-old with severe endometriosis with a family history of endometriosis or premature menopause who probably should be freezing her eggs, right? Versus you may have a 37-year-old individual who's very healthy, has an excellent egg reserve. Genetically, there is no risk factor. And that person perhaps can wait for another year or two. So, there's nothing wrong with that. So there's no one size fits all in what we do, but rather understanding the individual risk and what their aspirations are. What do they want to do? Do they want to have a kid in a year or in 5 years? What's their family history? So that all goes into the understanding of their, number one, potential, their history, their risk factors, and most importantly, when they want to complete their family. And all of that goes into this complex mathematical calculation that we do on our end. And then we counsel patients on the best age or timing for egg freezing. So it's not like when it's 35, everybody has to freeze eggs. There's no such thing. If somebody's 30 and they say, I have a lot of issues, but I'm 30 and nothing will happen to me because I'm so young, I won't have to worry about anything. Well, obviously, that's not the right way of approaching this issue either. So it's a little bit complex in the sense that we don't have one cutoff. And sometimes people want to hear that cutoff. They're like, what is the age? Tell me what the age is. And that can be different for a variety of different reasons. So I think that's where I would leave it for indications. And if anybody's interested, I think the best thing to do is talk to a fertility specialist, understand your risks, see where you're at, and see when the best time for you as an individual to freeze eggs would be.
Yes, I think that would be a very worthwhile conversation for sure. Actually, I'm going to jump ahead to a question I had. So what are the different considerations that go into egg and embryo freezing? And is one process better than the other?
That is a very good question too. So when we counsel patients for egg freezing, automatically we talk about embryo freezing, even though that may not be of interest. Well, in the past, we rarely talked about embryo freezing when egg freezing was not only experimental, but also not so successful. Because embryo freezing has been around for a very long time. Many labs now can freeze eggs, but in the past, that know-how was not available in every single lab. So now we have conventional freezing media. There are workshops, there are educational materials, courses can people take. So you can certainly become an expert in egg freezing. So it's readily available for staff in the laboratory. But back then, not only was not available, but also even people who did it were still doing research. So for that reason, we used to talk about embryo freezing back then because it was much more successful and much more predictable. And embryo freezing obviously refers to fertilizing the eggs. Now, that's a bit of an issue if somebody's single, because then that person has no choice or no chance other than using donor sperm. And that's a radical decision for some, and it's not for others, but certainly for some. And I think the majority, it's a bit of a challenge. So embryo freezing and egg freezing, they're certainly different in the sense that when you're freezing eggs, you're just freezing the eggs after you take them out. When you're freezing embryos, you're fertilizing the eggs and then you're growing them. Then you're creating embryos, then you're developing them, and then you're freezing them. And when you freeze embryos, you can actually genetically test them now. So then you know if there's Down syndrome, Turner syndrome, chromosomal problems, if that embryo is going to be a boy or a girl, if that embryo is going to result in a miscarriage or not. So you actually know a lot more when you fertilize the eggs and freeze them. In terms of the outcome, when you freeze an egg, on average, about 80% of the time they will survive. And this can change from one lab to the other. This can change from one person to the other. There are many variables, but on average, and this is a nice conservative number, about 80% of the eggs will survive. And then 80% of the eggs that survive will get fertilized. And then out of those, typically 1 out of 3 of those embryos will reach the final stage and become eligible for transfer. So if somebody has 10 frozen eggs, when we thaw them, on average, 8 will survive. On average, 6 of them will get fertilized. And about 1 or 2 out of the 6 will reach the final stage, and they'll become eligible or available for transfer. So in a way, out of 10 eggs that we froze, we'll have 1 or 2. Doesn't sound that great, but that's kind of the normal loss in a way. Now, the embryo freezing is a little different in the sense that when you get the eggs out, you don't freeze them. You just fertilize them right away. So you don't have that initial possible 20% loss. And once again, these are average numbers. So one person may have 30% loss. The other person may have 0% loss, meaning we thought 10 eggs, all 10 survive. and we fertilize them, all of them fertilize. And then they have 5 or 6 embryos. We have those cases in our lab. And sometimes some patients, their egg quality is not good, or the sperm is not good for that matter, and their yield is lower. But the average numbers are the ones that we're quoting. So please, listeners, understand that these numbers may or may not apply to you, but rather should just serve you as a guidance, as just a reference, so we have a rough idea. So when it comes to embryo freezing, we don't have that initial 20% average loss because we're not freezing and thawing the eggs. So automatically you have more embryos to work with on day one, and the fertilization rates are somewhere between 80 to 100%. So you not only gain that 20%, or you don't lose that 20% on average, once again, to the thawing, but also you gain a little bit more from the fertilization aspect. So typically you get double the number of embryos at the end, and immediately. So it makes it not only much more predictable, but you are also taking the entire process to the final stage when you're actually freezing the structure in a way, whether that's the egg or the embryo. In this case, it's the embryo. So that's the difference really between egg and embryo freezing, in the sense that embryo freezing makes it more predictable, maybe makes it a little more guaranteed, although nothing is guaranteed in medicine. We all, especially in fertility, that's for sure. That's a fact. But the uncomfortable part is you're introducing the sperm variable. And I mean, obviously in the future, you cannot take that sperm out. That's not possible. So either use that embryo or not. And if you freeze the embryos and then you have a partner in a couple of years, well, maybe you may not want to use that embryo that was frozen because it's using donor sperm or another sperm provider. So that is the challenge, I think, with embryo freezing. And the benefit is certainly you're taking everything to the final stage, and even it gives the option to do PGT, pre-implantation genetic testing. So in order to overcome this challenge in a way, we typically recommend patients to freeze at least 10 mature eggs, ideally 15 or more. I mean, more the merrier, certainly, so that even if we lose a bunch of eggs to thawing and fertilization and growth and development, if we start with a high number, we know that we're going to end up with a higher number as well. So that's why if the goal is just to freeze eggs, and typically when single women come in, I mean, I want to say over 90% of the time nowadays, we're just freezing eggs, not embryos, which is the exact opposite of what we used to do 15 to 20 years ago, which was just embryo freezing almost. So isn't that interesting? So, but in any event, the egg freezing, I think if we reach certain numbers, and even if we incorporate the loss rate with the expectation we're going to have a few to utilize at the end, as a general approach, we want to freeze at least 10 to 15 mature eggs, which then makes everybody comfortable, and so that we have a good yield at the end, and whenever it's time to thaw those eggs.
That is so fascinating. And, you really sort of broke down the complexities of both these treatments. And that brings me to the process itself, if you like. So what should patients expect when they decide to go through with egg freezing?
So the process starts with a consultation, assessment of their personal history, and just going back to our discussion a few minutes ago about their personal risks. Do they have pelvic pain? Do they have fibroids, cysts? Do they have endometriosis? Do they have a family history of infertility, pregnancy losses in cousins, sisters, or their mom? Is there a history of cancers in the family? The other thing that we look at is there any history of premature menopause in the family? So these are all variables and questions that we ask. In addition to that, oftentimes when we talk about egg freezing, I always feel like certain other things are ignored, just like other things that you can do to preserve your fertility, which is not just egg freezing. I mean, if you're smoking, if you stop smoking, you are preserving your fertility. So maybe, if you're smoking, just stop smoking and don't freeze your eggs. You're going to be preserving your fertility. If you're drinking excessively, using some kind of drugs, which is obviously a no-no, or if you're a poor lifestyle, you have a stressful lifestyle, you have some sleep disorder, well, first of all, treat all the medical problems, treat all the medical conditions, balance your diets, try to sleep at least 7 hours every night, exercise regularly. So all of these lifestyle modifications also fall under the umbrella of fertility preservation, right? So it's just not about, here, take some hormones and freeze some eggs. I mean, that's fine. We'll still do it, but it's just not that, but rather kind of treating and approaching the patient as kind of a whole. So I think that's one approach that has really served us well. The process, once again, starts with assessment, with a consultation, risk management, improving lifestyle as we manage, as we just discussed, and then starting hormone injections. We need to freeze more than one egg, so we just can't do this in a natural cycle. So we give hormone injections for 7 to 10 days. Patients are seen about 3 times within that time period for ultrasounds and hormone measurements, just to see how the ovaries are developing the eggs, how many eggs we have, and then what the sizes are. And then once the sizes reach a certain number, a certain diameter on ultrasound, the eggs become mature. And once the eggs become mature, the patients undergo a procedure called egg retrieval, which is aspiration of the eggs. It's done vaginally, so there's no abdominal surgery or anything like that. It takes about 15 to 20 minutes. It's a very, very low-risk procedure. And the eggs are aspirated in test tubes, immediately identified at the IVF laboratory. And then they're cultured for about 2 to 3 hours and then frozen that same day. Once the eggs are frozen, they're kept in liquid nitrogen. And liquid nitrogen is just so cold that it stops their metabolism, so they don't age. So if you freeze your eggs at age 34, you come back in 6 years, those eggs are still 34 years old, which is nice and interesting in that sense. Right. So, and at that time, the next step is to thaw the eggs and then fertilize them with sperm, then create embryos, plus minus genetically test them, and then transfer them into the uterus. While we're on this part of the discussion, let me also add on to a potential question that you may be asking me. I'm kind of feeling that you're going to ask me another question. An often question that comes is, well, when should I thaw my eggs? Like, should I be thawing my eggs like in a year if I'm 38? Is it safe to wait and why not until 47? Like, what should I do? When should I thaw the eggs? Well, number one, that's a medical question and a social one as well. So we don't want somebody to freeze their eggs at age 35 and try to thaw them at when they're 55, right? So that's too long of a wait. That's not only going to affect the success rates, but also going to increase the risk of having complications. And also socially, when somebody becomes a mom, there's a certain amount of time that we spend with our kids, and we want to see them graduate from school and college and get married and so forth. So there's that social aspect to waiting, but there's also the medical aspect to waiting. So the social one is certainly a personal one, and everybody's situation is different. So I think that's an individual decision that one has to make. When is the best time for that person to have a baby? That may be socially challenging. It may be financially challenging to become a single parent, right? So those are certainly complex issues and concepts that are, I think, still unresolved. Like, when is really the best time to have a baby? And some people say there is no best time to have a baby. I think it has to be something somewhere in between. So you have to plan it a little bit, but you cannot plan everything to the final detail. And I mean, that's life in general anyway. So I think when you're ready to have a baby, you're financially comfortable, I think that's when you thaw your eggs, socially speaking. That would be my recommendation, at least from my side of the table. Medically speaking, we want to thaw the eggs at a time when somebody's really healthy. They don't have any medical issues, because over time we tend to develop medical problems. The uterus may not be as healthy as before if we wait too long. People tend to develop fibroids, polyps. People can have irregularities in their cycles. They can have heavy bleeding. Thyroid disorders can happen later in life. So there can be a lot of medical issues that can affect not just the egg thaw, but the overall outcome of the pregnancy. So it's just not the thawing of the eggs and, hey, well, here you go, take the embryo and you're done. Well, you're not done until you have a healthy baby. And our goal is, healthy mom, healthy baby. That's kind of our concept. So medically speaking, you want to have the baby when you're still healthy. What is that cutoff? It's different for a lot of people. And once again, that goes back to improving your lifestyle and getting to a good weight and exercise program and minimizing your other risks. The other thing that I would like to finish off with in this part of the discussion is Egg freezing and neither embryo freezing guarantees outcome. So you may freeze your eggs right now and have 12 or 13 beautiful eggs, and you may just think that everything's guaranteed in the future. That is absolutely not the case. That is never the case, by the way. So if you're freezing your eggs and you're coming back, one good way to look at this is you probably should thaw these eggs and fertilize them and see what comes out of that. Hopefully something really good, which is very likely, by the way. But if it doesn't, then you still want to have some time so you can maybe grow fresh eggs and fertilize them fresh. So you don't want to do an egg thaw when there are absolutely no eggs left, because then you really don't have anything else to work with other than using donor eggs. So ideally, I think the egg thaw should be less than or before the age of 45, even younger, in my opinion. So if it doesn't go well, at least we still have some fresh eggs to work with. So that's an important concept to understand and plan on when to thaw the eggs.
So much goes into your work, and today I think we got a glimpse of all the sort of variations, all the considerations that you have in mind, when you approach these treatments, and it's completely fascinating. But we have come to the end of our time, and you really helped us cover a lot of the aspects of egg freezing. And it was another very useful conversation that I hope will help our listeners make decisions about their fertility. So for more information about egg freezing and other fertility treatments, or to reach Dr. Bayrak, please visit laivfclinic.com or follow us on Facebook or Instagram. Thank you for listening. Understanding Your Fertility is created by LAIVF. Please note that this podcast is intended for a broad understanding of the topics presented. It is not a substitute for the medical advice or care of a physician-patient relationship. Podcast listeners should always consult with their healthcare provider regarding any medical condition that requires professional attention. Follow us on Facebook, Instagram, and Twitter. If the information on this podcast was useful to you, please feel free to share it.